care of the family during pregnancy. Most tested topics: diagnosis of pregnancy, presumptive, probable, and positive signs, Nagel rule, estimated date of birth, maternal adaptation to pregnancy, partner adaptation, prenatal care, psychosocial developmental tasks, nursing interventions, and teaching. 1. Goals of prenatal care. Prenatal care is designed to promote maternal and fetal health, detect pre-existing maternal disorders, identify pregnancy-related complications, monitor fetal growth and development, provide health education, prepare parents for birth and parenting, include the spouse, partner, or significant other whenever appropriate. 2. Diagnosis of pregnancy. Pregnancy findings are divided into presumptive, probable, positive signs. Presumptive signs. Experienced by the woman, not diagnostic. Know these: amenorrhea, breast changes, nausea and vomiting, urinary frequency, fatigue, quickening, 16 to 20 weeks. Probable signs. Observed by the examiner. Know these: Goodell sign, Chadwick sign, Hager sign, positive pregnancy test, urine or serum, Braxton Hicks contractions, ballotment, positive signs, confirm pregnancy. These are the only definitive signs. Visualization of the fetus by ultrasound. Fetal heart tones heard by Doppler or ultrasound. Fetal movements palpated by the examiner. Fetal movements visible to the examiner later in pregnancy. 3. Estimated date of birth, EDB. Most accurate method, first trimester ultrasound. If assisted reproductive technology is used, EDB is based on embryo transfer date. Nagel rule. Calculate EDB. First day of LMP. Add 7 days. Subtract 3 months. Add 1 year, if needed. 4. Maternal adaptation to pregnancy. Pregnancy is a major developmental milestone. Major developmental tasks: accepting the pregnancy, identifying with the mother role, reordering relationships, establishing a relationship with the fetus, preparing for birth. 5. Accepting the pregnancy. Important concepts. Acceptance develops over time. Ambivalence is common and considered normal. Pregnancy may be intended or unintended. Emotional lability. Rapid mood changes commonly occurs because of hormonal changes and life adjustments. Persistent, intense ambivalence into the third trimester may indicate unresolved conflict with the motherhood role. 6. Identifying with the mother role, influenced by childhood experiences, relationship with one's own mother, cultural beliefs, previous childcare experiences, desire for parenthood. 7. Reordering relationships. Relationships commonly change during pregnancy. Important relationships: mother-daughter, pregnant woman, and partner. Women commonly need to feel loved, to feel valued, to know the baby is accepted by the partner. Nursing role. Promote effective communication. Assess available support systems. 8. Sexuality during pregnancy. Sexual desire often changes. First trimester usually decreases because of fatigue, nausea, and breast tenderness. Second trimester often increases because of improved well-being and pelvic congestion. Third trimester often decreases because of discomfort and body changes. Teaching. Encourage open discussion with the healthcare provider and partner. 9. Maternal fetal attachment. Rubin describes 3 phases. Phase 1. I am pregnant. Accepts biologic pregnancy. Focuses on herself. Phase 2. I am going to have a baby. Usually by the 5th month. Fetus becomes a separate individual. Attachment increases after. Quickening. Hearing fetal heart tones. Ultrasound visualization. Phase 3. I am going to be a mother. Prepares realistically for parenting. Imagines the baby's characteristics and future. 10. Preparing for birth. Women often prepare by reading books, attending childbirth classes, watching educational videos, talking with experienced mothers. Common concerns: labor pain, safety of mother and baby, birth process, nursing intervention, provide education to reduce anxiety. 11. Partner adaptation. 3 developmental phases. Announcement phase. Accepts the biologic fact of pregnancy. Ambivalence may occur. Moratorium phase. Accepts the reality of pregnancy. Reflects on parenthood. Focusing phase. Prepares for labor. Begins thinking of self as a parent. Plans role during birth. 12. Partner attachment. Attachment behaviors include talking to the fetus, singing to the fetus, feeling fetal movement, rubbing the mother's abdomen, choosing a name or nickname, participating in childbirth classes. 13. Nursing responsibilities. The nurse should assess emotional adaptation, assess family support, encourage partner involvement, teach normal pregnancy changes, reduce anxiety through education, support communication within the family, individualize care for all family structures, including LGBTQIA families. Must memorize pregnancy signs, presumptive, amenorrhea, breast changes, nausea, fatigue, urinary frequency, quickening, probable, Goodell, Chadwick, Hagar, positive pregnancy test, Braxton Hicks, ballotment, positive, ultrasound visualization, fetal heart tones, examiner palpates fetal movement, examiner sees fetal movement, NCLEX style questions. 1. Which finding is a positive sign of pregnancy? A. Amenorrhea. B. Chadwick sign. C. Hearing fetal heart tones by Doppler. D. Braxton Hicks contractions. Answer C. 2. Which finding is considered a probable sign of pregnancy? A. Fatigue. B. Ballotment. C. Quickening. D. Nausea. Answer B. 3. According to Naegeli rule, the estimated date of birth is calculated using the A. Date of conception. B. First positive pregnancy test. C. First day of the last menstrual period. D. First fetal movement. Answer C. 5. Which statement about ambivalence during pregnancy is correct? A. It always indicates depression. B. It is abnormal after the first trimester. C. It is a normal response while preparing for a new role. D. It predicts poor parenting. Answer C. 6. Which partner behavior best demonstrates prenatal attachment? A. Avoiding discussions about the pregnancy. B. Talking and singing to the fetus. C. Refusing childbirth classes. D. Limiting involvement in prenatal care. Answer B. Quick memory aids. Pregnancy signs. PPP. Presumptive equals patient says it. Probable equals provider observes it. Positive equals proof of fetus. Rubin's 3 phases. 1. I am pregnant. 2. I am going to have a baby. 3. I am going to be a mother. Naegeli rule. LMP plus 7 days minus 3 months plus 1 year equals estimated date of birth. EDB. Prenatal care. Begin prenatal care soon after the first missed menstrual period. Purpose. Detect complications early. Promote maternal health. Promote fetal health. HIV screening. Who should be tested? Answer. Every pregnant woman, regardless of risk factors. Reason. Early treatment reduces fetal transmission. First trimester danger signs. Report immediately. Vaginal bleeding. Severe vomiting. Fever and chills. Burning with urination. Diarrhea. Severe abdominal cramping. Normal discomforts. Fatigue. Mild nausea. Urinary frequency. Exercise during pregnancy. Exercise is encouraged. Running. May continue if already accustomed. Often change to walking around the 7th month. Always. Warm up. Stretch. Avoid injury. Prenatal screening tests. Multiple marker test screens for Down syndrome, neural tube defects, chromosome abnormalities, 3rd trimester warning sign, danger sign, decreased or altered fetal movement, normal discomforts, constipation, mild ankle edema, occasional palpitations, alcohol during pregnancy, NCLEX. Answer. No amount of alcohol is known to be safe. Recommendation. Abstain throughout pregnancy. Common pregnancy discomforts, low back pain, pelvic rock exercises, mood swings, normal, caused by hormonal changes. First trimester libido usually decreases because of nausea and fatigue. Breastfeeding contraindications? Contraindicated. HIV infection? Not contraindicated. Hepatitis B? Everted nipples. Remote history of breast cancer in this test bank context. Father's role, primary role. Support and nurture the pregnant woman. Safe passage. Best indicator. Keeps all prenatal appointments. Child's understanding of pregnancy. A 3-year-old commonly asks, "What will the baby eat?" Older school-age children often ask, "How will the baby get out?" Cultural considerations. Purpose of pregnancy rituals. Protect the mother and fetus. Greatest cultural barrier to prenatal care. Modesty. Pregnancy facts. Normal pregnancy. About 10 lunar months. About 40 weeks. Trimester. about 13 to 14 weeks. Psychosocial adaptation, mood swings, normal, progression of maternal attachment. I am pregnant. I am going to have a baby. I am going to be a mother. Father's adaptation, 3 phases: announcement phase, moratorium phase, focusing phase, Kuvaid syndrome. Expectant father develops pregnancy-like symptoms. Initial prenatal visit. Nurse should screen for depression, assess family support, ask about drug use, assess for domestic violence, empty bladder before pelvic examination. Follow-up prenatal visits. Schedule monthly through 28 weeks, every 2 weeks from 28 to 36 weeks, weekly after 36 weeks. Watch for supine hypotension during abdominal examination. Hypertension, BP 140/90 or higher. Personal hygiene, safe. Tub baths unless membranes have ruptured. Wipe front to back. Warm water for nipple care. Avoid bubble baths, bath oils, soap or alcohol on nipples. Breastfeeding preparation. Pinch test. Determines whether nipples are everted or inverted. Dental care. Best time, 2nd trimester. Reason, most comfortable period for treatment. Work and travel. Teach. Walk every hour. Wear seatbelt correctly. Avoid prolonged sitting. Airport metal detectors are safe. Medications and vaccines. Remember, OTC drugs are not automatically safe. Greatest fetal risk occurs during the 1st trimester. Live vaccines are contraindicated. Killed vaccines may be given. Secondhand smoke is harmful. Multifetal pregnancy. Common findings: more anemia, greater weight gain, more back pain, more varicose veins, higher risk for preterm birth. Centering pregnancy. Features: groups of 8 to 12 women, same gestational age. Group begins around 12 to 16 weeks. Women check their own BP, weight, and urine. Nurse assesses fetal heart rate and fundal height. Supine hypotension. Symptoms: dizziness, faintness, agitation. Intervention: turn the woman onto her left side. Report these immediately. Call the provider for vaginal bleeding, rupture of membranes, severe headache with heartburn or epigastric pain. Vaccines during pregnancy. May receive tetanus, diphtheria, hepatitis B. Avoid rubella, chickenpox. Reason: live vaccines are contraindicated. NCLEX matching facts. Severe vomiting in early pregnancy. Hyperemesis gravidarum, epigastric pain late pregnancy. Hypertension or preeclampsia. Decreased fetal movement. Fetal jeopardy or fetal death. Severe back or flank pain. Kidney infection or kidney stones. Glycosuria. Gestational diabetes. High-yield NCLEX memorization list. Start prenatal care after the first missed period. Screen every pregnant woman for HIV. Vaginal bleeding is never normal during pregnancy. Decreased fetal movement is a late pregnancy emergency. No amount of alcohol is considered safe during pregnancy. Pelvic rock exercises help relieve back pain. HIV is a contraindication to breastfeeding. The partner's main role is support. Keeping prenatal appointments promotes safe pregnancy. Modesty is a common cultural barrier to prenatal care. Pregnancy lasts about 40 weeks or 10 lunar months. Mood swings are a normal hormonal response. Monthly visits continue until 28 weeks, then every 2 weeks until 36 weeks, then weekly. Walk every hour during long trips. The 2nd trimester is the best time for dental care. Live vaccines are contraindicated during pregnancy. Multifetal pregnancies have a higher risk of preterm birth. Turn a dizzy pregnant woman onto her left side. Tetanus, diphtheria, and hepatitis B vaccines may be given during pregnancy. Hyperemesis gravidarum, vaginal bleeding, rupture of membranes, and decreased fetal movement require immediate evaluation.